Hi there, I'm Sue Schaefer. I'm a diabetes nurse and I've worked for the last 9 years with First Nations people doing diabetes education, and I do a crazy character called Mrs. Pudding for diabetes education. I think the interesting thing about diabetes is that you can't really think of one aspect of your life that really hasn't been impacted by diabetes. It's kind of like it gets woven into the fabric of your whole life. There isn't really one thread that I can pull out that diabetes hasn't impacted. So I'm proud to say that November will be 25 years living with type 1 diabetes, and so far, touch wood, no complications of diabetes, so that's a huge relief and an accomplishment. So I think people really have to understand that. There's a lot of guilt and shame that comes with the diagnosis, that somehow you've brought this on yourself, and really want people to understand that this is not your fault, absolutely. The other thing I would say is just give yourself some time to actually grieve. Give yourself some time to think about what this means, and be mad and sad and angry and all of that stuff, because you need to take that time. It is a big shock and it is a loss, and so take some time to kind of get that stuff out of your system. And if you're having trouble with that, then really make sure that you talk to somebody with diabetes, or talk to a counselor or somebody, because don't try to minimize that. It is a big deal, and treat it as such. There's lots of places that people can go to get support. One of them, of course, is your physician. And I would really make sure that you have honest chats with your physician about what it is you need around your diabetes. Physicians don't often have that time to be that ear for you, so that's where you need to look for something else, like maybe the Diabetes Education Center. You might want to look into counseling, look to see if there's support groups, the Canadian Diabetes Association, just the people down at the store here in Victoria. They are phenomenal. They're so welcoming and helping. We've got tons of resources there. And then there's just really cool social media sites where you can go and get information, get on chat rooms, hook up with other people, and just really part of it is just getting that sense of, I'm not the only one. You know, I'm not the only one with this, I'm not alone, and then just also hearing that other people are struggling with the same issues. There's comfort in that.